See, there the counter's going. Yes, it is.
Okay.
So I am
Yep.
live with. Now I want to pronounce your name correctly. As
Sure.
I talk to different people who are mutual friends,
Right.
is Ashu Goyle or
It's Ashu.
Ashu? Okay,
Yep.
then
Ashu.
I want to
Yeah.
get that right because you
Yeah.
hear 100 different pronunciations. Tomato, tomato, and um,
Exactly. I answer to
I
just about everything now. So yeah, I've been called
well,
all kinds of things. Yeah.
it's a pleasure to have you on, especially,
Thank
and
you.
of course, I will have the links to all your websites, social media, and everything that everybody can check out all the cool stuff you do in the summary. But and anybody does that, you can press pause right now if you want to, or if you're driving, don't do that. Just continue listening to this episode. But a lot of very cool, interesting things that seems to be in today's world we live in, and not to get off on a tangent, but we're in the presidential race or the heat of it, and the media, legacy media, mainstream, and then you have the alternative with the, depending who you listen to, but the Rogans and the Tucker Carlsons, and I'm sure there's a whole bunch of others, but it's also very, very big in the health industry.
Sure.
You being a prime example of, we'll call it alternative medicine or modalities for, and it wouldn't, I've been asked about it quite a bit because I've had a number of different people on the show, and they asked me my opinion on it, and my first response is, well, they wouldn't be successful if it didn't work. So I guess the first question I have to jump in right away, we're just going to jump in the deep end because we can cover so much as we talked to just a few minutes ago. With this thing can go very long and very deep. But what is it with not to get you in trouble with any medical licensing board or AMA, but what is it about that everybody would agree, I think, that the medical industry is a catastrophe. So what is it that makes someone like you so successful, and that not only successful in a business practice, but successful with getting people back to health and doing the things that they want to do in an active lifestyle?
Yeah, that's a great question. So I'll talk a little bit about my background. So I'm a double board certified anesthesiologist, interventional spine and pain management specialist. I trained at Cleveland Clinic, did my anesthesia residency there, did a pain fellowship there, which involved heavily focused on interventional spine. So these are non-surgical modalities to help people relieve back pain, sciatic pain, neck pain, mid-back pain, and joint pain. So, that training afforded me incredible diagnostic skills. And I think that's the first part, is being able to diagnose an ailment correctly and then offering the appropriate treatment. I think a big part of what we do is using different modalities to help people achieve whatever goal they're trying to achieve. And the key is to individualize care. The problem with today's healthcare system is that it doesn't allow for that. The insurance-based medical system gives us maybe 5 to 10 minutes to see a patient or a person and come up with a plan and then move on to the next one. It's a volume-based, episodic-based care system. What I've been able to do, fortunately, over the last 17 years of private practice, is evolve my practice into one where I can afford to spend time with my patients and really connect with them. And that's why I think I'm more successful than maybe some other people who are stuck in the insurance-based model of healthcare. With the insurance-based model of healthcare, we have a limited number of tools that are available to us. The insurance companies dictate what we can and can't do. They tell us, well, you can treat this one body part, and our goal is 50% better. Well, 50% is incredibly subjective, and for some people, 50% isn't satisfactory. Right? So sometimes we have to step outside of those bounds. And I'm able to do that because a significant portion of my practice is cash pay. So people feel the value in spending time with their provider and being heard and, really getting a thorough evaluation and then being offered modalities that are sometimes outside of our traditional pain management or insurance-based paradigm. And that's where the regenerative medicine modalities come into play. That's where we can talk about nutrition, lifestyle, and overall health and well-being. And so I think it's a matter of combining all of those factors to treat people. And that's where the more successful outcomes happen. Whereas in the insurance-based system, we can do one injection of steroids, which can be profoundly beneficial in terms of relieving pain and reducing inflammation, but they are destructive to tissues and they come with a myriad of side effects, some that can be very detrimental.
I want to say that, because some people, but based off some of the guests I've had on, said, well, you're just anti-medical institute. And I said, that's not true. If somebody, God forbid, that they got in a car accident, somebody ran a red light, ran in their car and they broke their leg, or they, dislocated their shoulder, or something that was catastrophic. Yeah, obviously that you've got to get that fixed. If there's a severed artery, they got to get in there and sew that thing up for obvious reasons. But as you mentioned, the 5 to 10 to maybe 15 minutes, if you're lucky, with your physician, how do you understand what somebody, where they were, what they've gone through, and how they got to where they are today, or at least start to get understanding when you've got to cram that in 10 minutes or less. And most of the physicians who I have sought out in the last number of years, I would say the last 7 to 10 years, have been in the same, using the same model that you do. One of them, I went down and saw Brian Carroll, who's one of Dr. Stu McGill's top guys, or his protege. I hope, Brian, if you're hearing this, and I don't get it wrong, but I think people understand what I'm getting at. But they're very close, and they wrote the gift injury. But Brian's, we had 2 hours of talking together. He wanted to understand me as a person in the story, and he said Dr. McGill will go sometimes 3 hours. So, and that's just figuring out something that's a structural problem, where you're dealing with more with structure with pain, but chemical issues when you get into the diet and the gut. And I would have to say that, and maybe we can get into that a little bit, as well as the psychological aspect of it, is how much is it triggered by the same, let's say, an engram, something's burned into somebody's head. Now, just for you listeners out there, for example, for myself, for so many years when I was playing pro golf, going to tournaments almost every week, and as my back progressively got worse, it would trigger, knowing I was going to a golf tournament would trigger my back to start to get irritated. It was the craziest thing in the world. And even when I didn't play for a number of years, outside of casually, with some friends here locally, when I got done playing professionally, if I was going to go to a local tournament, I'd be fine up until about a day or two before the tournament, and it would just slowly start to feel like it was creeping in. So that's what, if that kind of paints a picture for somebody out there who probably is thinking, "Holy shit, that happens to me too." And I had this injury many years ago, and
it's a form of PTSD. It really is.
Huh.
Yeah. And so those 2 days leading up to your golf tournament, you revert back to that because your body remembers that traumatic event and it hasn't been fully processed. So in my practice, I do take care of a lot of elite athletes, NBA players, some head coaches, NFL players, MLB players, NHL players, collegiate athletes. And through those connections, I've met some extraordinary concierge psychiatrists who specialize in elite athletes and the psychology of elite athletes. And this is something that's come up before through conversations with some of my friends who treat these elite athletes. It's like, they get injured and they're so focused and so committed to, their team and being successful at what they do. They get injured, it takes them out of the game. And so that's a traumatic life event for these elite athletes. And like for you as well. I mean, you experienced that back injury. It took you out of the game. And so you do the rehab, you do the work, and now you're coming up to this big event again. And your mind maybe hasn't processed the traumatic event. And so it starts to manifest physically. And so the good news is there are people out there who can help with that type of trauma and help release it and process it. So it can keep you in the game longer.
Very interesting. I had Dr. Ray Pryor on, psychologist who works with a lot of athletes and celebrities. And I should probably send him a note and say, hey, if this continues, I need you to break this cycle just for my own mental well-being.
Yes, it's all about mental well-being. I think that's where it starts, especially with elite athletes. I mean, they've got the physical capabilities. Then it's the mindset and the mentality that takes you to the next level.
Let me go to back up just a little bit, because I probably jumped the gun right there. But one of the things that seems to, as I obviously, Golf 360 covers a lot of things, hence the name. Anything involved in the game or your life. But one of the things that I see in the physical fitness side is a lot of these, is there's arguments everywhere. It seems like everyone's trying to knock everybody else's system. Golf coaching is very similar. Even though I think it's for the betterment of the game, I think some people take it too personal and they try to denounce somebody else's theories or whatever they're working on. That's neither here nor there. But one of the things that I have noticed, in particular in the physical fitness sector, is when somebody uses the term functional training, because they start getting on, well, if you're strong, you don't need to do certain things, and functional, what is functional? And they start down this road of this debate to try to classify it. But when someone, they move into more of your area of overall health, and again, physical, mental, and the body itself, as far as whatever all the systems working together.
Right.
I think there's a difference in that, and that functional medicine does have a stronger meaning, or can have a stronger meaning. So can you just discuss that or touch on that a little bit, to kind of educate some people who might have that question in their mind of, what is functional?
Right. So functional medicine, so I think there's two different components to that. I think traditionally when we speak about functional medicine, we think of the Dr. Mark Hymans of the world, right? So really focusing on gut health and really improving our internal microbiome and our internal health, which then manifests outwardly in our physical function and form, right? And so that's one aspect of functional medicine. The other aspect is treating the body as a functional unit. Right. And that's where the MSK, the musculoskeletal aspect comes in. And that's where I believe the spine comes in. And so I'll speak to my specialty, which is interventional spine and musculoskeletal medicine. So when I treat someone, and once we step outside of the insurance paradigm, we can treat the lumbar spine as an entire functional spinal unit. So for example, I see a lot of golfers in my practice. I see golf pros as young as 19 years old who started playing golf when they were 3 years old. And they come here with back pain, and invariably they have an L4-5 dysfunction. That's where that rotation is in golf. It occurs primarily at L4-5. And so we'll see conditions called spondylosis, which is degenerative wear and tear of the joints. But then it also causes degenerative wear and tear of the disc itself and the surrounding ligaments. And so when I approach these people with a treatment plan, it involves treating the entire functional spinal unit, which will involve treating the discs. It will involve treating all the surrounding ligaments, the interspinous ligaments, intertransverse ligaments, supraspinous ligaments, the surrounding muscles, the multifidi muscle, most importantly, as well as the epidural space, the nerve roots, and the facet joints and the facet capsules. Intimately related to the lumbar spine also are the sacroiliac joints. These are the joints where the tailbone connects to your hip bones, if you will. And these are biomechanical joints that are really responsible for stabilizing the pelvis and then transmuting the axial forces of the spine, which is gravity, and sending them down each leg equally so we can maintain our upright posture without falling. And so these joints get intimately involved as well. So that's the entire functional unit of the lower lumbar spine. And so when we talk about functional medicine, we can talk about it from a musculoskeletal standpoint, but then we can also talk about it from more of an internal medicine standpoint, where we're treating the microbiome, our gut health, which then can manifest as health in all of our systems, cardiovascular, neurological, musculoskeletal as well.
Do you think that like the spondy and the spondylolisthesis from golfers comes from, I use the golf phrase in coaching, is early extension, where the pelvis is moving in towards the ball too soon, and then just that shearing force over repetitive motion as well as the twisting is being a large contributor to that problem, because golfers seem to have it excessively. Golfers and female gymnasts, I think spondy is a big thing in female gymnasts because they're always back bending.
Exactly. Female gymnasts, golfers, my deadlifters too. I have patients who are hardcore deadlifters and they create a spondylolisthesis. They'll get a grade 2, grade 3, which is a pretty pronounced slip there. And then also I take care of some professional figure skaters and ice skaters, and they also have the spondylolisthesis as well. But I think you nailed it. It's a combination of that extension and rotation, and then the pelvic tilt that happens as well with that entire, the golf swing is a very dynamic motion. There's that whole kinetic chain that's involved. It extends all the way from the foot through the entire leg, through the hip, through the entire spine, into the neck, the upper extremity. That's why we get golfer's elbow. Also tennis elbow, which a lot of golfers have that as well. Even in rotator cuff, we see a lot of rotator cuff injuries in golfers. But it's that whole kinetic chain that's involved. But yeah, as far as the spondylolisthesis, it's that twisting, extension, and all of it happening, that torque, all of it happening at the same time. It creates instability in the ligaments and the joint capsules. And then we get that slip there.
I was always under the impression, because like most golfers, I think the first time I felt any disc herniation or protrusion was when I bent over to a compression flexion motion, very
Yeah,
similar to deadlift. I picked up my bag after walking 36 holes and felt like somebody hit my back with a blowtorch.
sure.
And I was young enough that everything just moved back into place. I grew out of it, is what I was told. But
Hmm.
deadlifting, Dr. Richard Geyer was on, and I asked him, I said, is there any exercise that you see golfers doing that you just would love to just go hit them upside the head and say, don't ever do this again? And he said, without a doubt, deadlifts.
Right,
For the flexion compression of the L4, L5, and then you get that spondy where it's going to be, because there's my limited understanding of anatomy. Obviously, I'm an amateur at it. I'll say that, but I've been through enough, and I've been around enough people like yourself that I have a decent enough understanding to talk somewhat intelligently, and on this show. But when there's, your thoracic has your ribs connected to it. Your spine doesn't really have any support to it outside of the soft tissue and the muscular support. And if you get something out of place, and now you're putting load on it, and you're putting torsion and torque and everything else, and it just moves a bit, and you're going down, and now you start adding 200, 300, 400 pounds of a lever arm of weight pulling you one way, and you're trying to pull it the other, and you've got nothing but musculature, ligaments, and tendons to support it. I don't understand the benefit to risk ratio of why golfers, I mean, I do, through the ground force reactions, is why they're told to do it, but
hmm
I just don't see the risk reward benefit, one, from doing it myself and getting a scare, but also, so many people and so many experts like yourself are like, no, don't. If you want to play golf at any level, unless you have a specific need that is addressing, which I can't think of
right.
any. I'm sure maybe somebody can. I don't understand why anybody would do heavy weighted deadlifts. Heavy meaning, let's say, 200 pounds or more.
Exactly. I see no need for it either. I mean, there's so many other ways to work your lower back, your glutes. And I think deadlifting is one of the worst things that you can do for your spine. At least, and I'm seeing that in my clinical practice on a regular basis too. I've got some collegiate athletes that have come here, and most of their injuries occur not while they're playing their sport, but while they're working out. And in a lot of those patients, it's because of deadlifting. And I just think it just, like you were explaining, you did a great job, but it's all that torque on the disc. It creates disc herniations. So, just to get back to the basics for people who may not understand disc morphology or structure, I like to describe our discs, which are the cushions between the backbones, right? So we have
Mm-hmm.
cervical spine, thoracic, and low back, lumbar spine. And in between each one of those vertebrae are these discs. And these discs, I like to describe them as jelly-filled donuts. So you've got the jelly on the inside, then you've got the dough around it holding it all together. Then you have a car tire, and that's the outside fibers that basically
Is
give
that the
the
annulus?
annulus, exactly,
Yeah.
the annulus fibrosus, right? So um, I liken it to the car tire holding everything together. But when you really put all that pressure and weight and torque on that entire structure of the disc, those tire fibers can split open. And now you've caused damage to a structure that doesn't have a rich blood supply. And why that's important is because when you have an injury, blood and platelets are one of the first mechanisms by which we initiate healing. And so when these discs herniate and rupture and the tire fibers split, there's no blood supply to help those fibers basically heal. And so the material from the inside of the disc leaks out. It can cause that burning pain like you were describing when you bent
Mm-hmm.
over. That's where that searing, burning pain comes from. And it can hit the nerves, and then that's what causes sciatic pain or pain down the legs, if you will, right?
Mm-hmm.
So, and that's where the regenerative medicine modalities that I use come into play. I can use platelet-rich plasma, which is a highly concentrated platelet, basically platelet volume that I use, and I can inject that around the annulus. So, in the areas where we don't have a rich blood supply, where healing normally doesn't occur, now we can create a situation where healing can occur. And there have been a number of studies that have shown that platelet-rich plasma can be really beneficial for disc herniations, disc protrusions, and then also these annular tears in the disc.
What would be the difference between what you do and stem cell replacement?
So that's a great question. So stem cells, legally in the US, we can only get stem cells from two areas. And so one of those areas is the bone marrow. And so we typically get bone marrow stem cells from the hip bone, the side of the hip. We call that the iliac crest.
Mm-hmm.
So we can take a specialized needle, go into the iliac crest, and we can aspirate bone marrow concentrate. It's not as painful as you would think. We localize. We use a lot of numbing medicine. We go in there, but it's interestingly, most patients they tell me that that's not the worst part of it. It's when we aspirate the bone marrow, there's a suction effect that occurs throughout the entire body. Yeah, they feel it throughout their entire body, and that's the most uncomfortable part.
Gotta be some. Would the feeling be almost like a very sharp pain as it's being pulled, and it's because it's going to move everything. All the marrow. If you're pulling, if you're sucking out one area and creating a vacuum, it's going to get almost like a jolt and move from everywhere.
Yeah, it's like a vacuum is how they describe it, but not necessarily a sharp pain, but it's uncomfortable. So that's one area we can get bone marrow. The other place is fat. So we can do what's called adipose stem cells, where we get we basically do a mini liposuction procedure. We can take fat cells, which are rich in stem cells, as they actually have more viable stem cells in our bone marrow, depending on the age of the person. And so we can process that, and we can get stem cells from those areas. So platelet-rich plasma is different. So that comes directly from our blood. So we just do a simple blood draw for that. And then we spin the blood in a centrifuge at a very high rate, usually 3,500 RPMs, for about 10 to 15 minutes, depending on what system we're using. And what that does is it separates the red blood cells from the platelets, the white blood cells, and then the platelet poor plasma. So the platelet-rich plasma, which is PRP, which many people might be familiar with, that's not a stem cell treatment. But what's amazing about the platelet-rich plasma is it's a high concentration of platelets. Inside these platelets are alpha granules. When they open up and release their contents, they release growth factors, and these growth factors serve as homing signals for stem cells in our body. So the stem cells get recruited to the area. So that's how the PRP works. It's basically a homing signal for stem cells. So that's the difference.
So the PRP is the one that you've had success on angular tears and the rebuilding of the disc outer body.
Right, and that's where most of the data is too. Yeah.
Because I had asked Brian Carroll about stem cell injections, and he said I think that a lot of it was, there was still a lot of debate on it, whether it was working or not. I mean, it's obviously great for joints. And of course, there's argument that there is this case that your vertebrae are joint. It's a joint area, that moves, but to put stem cells into the disc to try to regrow that tissue, you're basically going into the disc itself. So you're going through the annulus into the disc, and is really poking another hole in something that has a potential to leak out where it's already torn. Is that a good idea? So that's
a great question.
I would like your idea better on how you're going about it, because how else are you going to get anything down there when it's not a blood-rich environment?
That's exactly right. So I trained at Cleveland Clinic. I mentioned that earlier. During my interventional spine and pain management fellowship, I actually co-authored a paper with Dr. Leo Caparel on techniques for accessing discs. So I've done probably close to 1,000 intradiscal procedures until they started going out of style. But here's the thing about that. So right now I'm not injecting the disc directly, because there's a huge infection risk with that. It's called discitis. And discitis is an infection of the disc, and that can be a very devastating complication of an intradiscal procedure, right? So I tend to avoid that. I'm getting fantastic results by injecting the epidural space anteriorly, which is the front part of the epidural space, which is the closest area to the disc. I've got patients, we've got repeat MRIs on that have showed reversal of some of the degenerative changes, which is pretty amazing.
That is amazing.
But to answer your question about accessing the disc, so with the orthobiologics, that's the field of medicine where we use the body's own healing ability to treat orthopedic conditions. When we access the disc and inject, let's say, PRP or bone marrow stem cells inside the disc, many times as we withdraw the needle, we're also injecting PRP or bone marrow stem cells all the way out to the outer annulus. So the area where we poke the hole in the disc is ideally getting filled up with biologics, which will help prepare that area of entry. Prior to doing orthobiologics, we were doing discograms, which were these basically a study that we would do. We'd put needles into many different discs, pressurize the discs with contrast to see, number one, if there was a defect in the disc itself, and number two, if we could reproduce a person's pain by pressurizing the disc. In those cases, we were actually causing trauma to the discs. So around 2010, 2011, doing those discogram procedures kind of went out of style. Like the risks didn't seem to, justify the benefit, which was very little. And so, but with these biologic therapies, I think there's more promise there, because if we are accessing the disc, we can inject the biologics on the way out. And that's what most people do. My colleagues who do a lot of intradiscal procedures tend to do that.
Yeah, it makes
Yeah.
total sense. Did you say you go in anteriorly, so from the front when you do that?
I apologize. No. So I'm going into the epidural space, but the epidural space has a posterior space and an anterior space. So there's a few different approaches we can get into the epidural space. So one is a transforaminal approach, where we go through the foramen, which is the little opening on the side of the bones where the nerve roots come out of. So we can go into the front part of the epidural space there, the foramen, and inject anteriorly, but it's still in the posterior space of the spine. Yeah.
Well, and that might sound crazy to somebody out there that I would even ask that question. And the reason I did was when Dr. Geyer was on, when he said they do the disc replacement, they go in from the front, which is why they have to have a general surgeon there to move the intestines and everything else that's in the way. And I thought that was absolutely, I said, wait a second, you're telling me you're going from basically the stomach side of the body? He said, yes. And you move everything to the side. He's like, yes.
Yep.
So I'm like, so you're basically, your guts are kind of, not technically, was sitting on the table while you're putting a new disc in. He said, yeah, basically that's it.
Basically that is it. And that's been a way more successful way to do a disc replacement or even a fusion than the posterior approach.
And I would assume, or it was my understanding, that the posterior approach is because you're going to have to cut through so many layers of muscle that the ability to recover from that and not have pain from scar tissue and everything else is going to be detrimental on the old traditional way of going from the backside.
That's exactly right. Yeah. And then you get the scarring of those muscles and they stop functioning appropriately. Then over time, they'll turn into fatty atrophy, and then you lose stability of that area.
God, that's amazing. Because so somebody, and this is my own education, I only learned recently that I had always assumed, and I just started following a fella, what is his name? Dr. Ryan Peoples. He's a doctor of physical therapy. And he took his spondy and actually reversed it to where it's almost his L5 is almost gone posteriorly, where it's protruding. So he's actually overdone it. But he's got some very interesting things. I haven't gotten deep into his stuff. I just really found him the other day and started watching and dove in pretty deep. But for example, some very, very simple things that people can do so depending on your size, I'm 6'5", so a 75 centimeter ball. His theory is if you lay on that and you put that ball, the apex of the ball, where your spondy would be. So it's actually the pressure is trying to push it backwards to help alleviate some of that pain. And then I think the genesis, and I could have this wrong, somebody who knows him better, would be to get the pubic bone more in line with the breastbone, as opposed to having an anterior pelvic tilt where the pubic bone would be pushed backwards as the hips tip forwards, so that the abdomen is not being stretched as much, which would allow that vertebrae to scoot forward another millimeter or two. If you're already 1 or 2, get another one, and you're just doing yourself a disservice. But it was very interesting to see that. I'm sure you probably have known about these things for a long time. It's nothing new to you to push a vertebrae backwards if it's already protruding forwards. But to me, after years of playing pro golf and having back issues myself, I'm like, holy cow, why didn't I think of that? Why wasn't that done on me before?
That's actually pretty fascinating. Yeah. So I've never seen that, to be honest with you. Like, I'll send you
the link on Instagram when we're done.
That'd be fantastic. Yeah.
It was so. I'm like, wait a second, it can't be that simple. But then he has, like, for example, hip thrust when you're doing off the ground. You want the pubic bone to be almost forward in line with the sternum, and then you can go ahead and raise. And now I didn't subscribe again to his page yet to know the details of the intricacies of how he wants you performing movement. But something as simple as walking, doing the same. Yeah. So not getting excessive, like like a full lunge. People are always trying to stretch a hip flexor. Well, if you're stretching the hip flexor and making it too loose, you already have a destabilized joint. You're going to just make it easier for that thing to move, and now you're in trouble.
Yeah, absolutely.
A lot of fascinating. As crazy as the internet is, and it's caused a lot of problems, there are some really good people out there, I think, doing
There
some
are,
very
for
good work.
sure. And one of the challenges, and I tell this to my patients all the time, is like, it's not one size fits all. So I'm all about individualizing treatment plans and finding the right fit for the right person, right? So when people look up exercises online, I'm like, that's great, but they may not be the right ones for you. So I think it's really important to see a really good qualified physical therapist and have one-on-one time with that person so they can assess your biomechanics. They can see how you're working out. They can watch your golf swing and they can make corrections in real time and then help you basically develop an exercise program that can correct whatever deficits or dysfunction the person has.
The thing that I learned most, he has some very good diagrams, video that he has some program, but I never realized, I had always thought that a posterior disc herniation was just the too much flexion and then the disc just sliding out the back. I did not realize on a spondycompression posterior herniation that it's the disc that gets the shearing of the disc moving anteriorly and then compressing, and then the disc being squeezed under all that pressure, and part of it being pushed out posterior. I'm like, holy cow, now it makes more sense.
Yeah.
On why somebody could feel fine for weeks or months or a year or so, and then all of a sudden just make the wrong movement where they either flex or extend too much, and all of a sudden they can't move for 6 months, or they have a
Exactly.
very hard time.
Yeah. Well, and that's the thing about the spine. It's a very dynamic structure. I tell people this all the time. When they show up, they'll have a herniated disc, let's say on the left side. And that's where predominantly where their pain is. And then they'll be like, oh yeah, but for 3 days I had pain on the opposite side. I'm like, well, that's a function of biomechanics and what activity and how you're loading that disc at that particular moment in time is manifesting. So you can have, like we were talking about annular tears, you can have a tear, the disc is protruded on one side, but then if you're overcompensating, you can create dysfunction on the opposite side, and that disc can slip over to the other side as well.
What has been the success rate, you would say, on the injections for the redevelopment of the soft tissue of a disc, or that area, and the tightening or the strengthening of the ligaments to pull that back in place after you have done some of these holistic practices to aid in that?
Yeah, I mean, my personal success rate is over 90%, but I'm very selective with
Awesome.
my people that I choose. Exactly. I have a very strict pre-procedure protocol. So much so that some people have seen it. They're like, I'm not going to do this. I'm like, well, I'm not the guy who's going to help you then. You can go back to the other people that you've seen because, I mean, it's really, I like to call it audience participation. Like, you have to be committed to your outcome. And so that's what my pre-procedure protocol is. Involves nutrition. That's the biggest part of it. So I like people to get onto an anti-inflammatory diet, avoid processed foods, eliminate sugar, no alcohol, limit caffeine to the best of your ability. And I provide them with a meal plan, recipes, grocery lists, all that kind of stuff, so they could at least get started, and modify as needed. But the goal is to start healing yourself from the inside out. So you're going to create this healthy plasma and healthy platelets that I can use to treat the injuries that we're going to be targeting. And then there's supplements that are involved too. I mean, most people aren't getting enough of their nutrients through food. So that's where high quality supplements come into play. And there are a few that I'm a big fan of. So I like to have my people start that as well. And then physical therapy and movement. So I like to have the body primed for whatever procedure we're going to be doing. So the healthier you are before we do the procedure, the better the outcome. So I think there's, the pre-procedure protocol is very important. And the ones who commit to it tend to have a better outcome. They make really good platelet-rich plasma. Their platelet-poor plasma tends to be really, really functional as well. I also incorporate hyperbaric oxygen therapy into my pre-procedure protocol. And I'm not sure if your viewers are familiar with that, but this is where you go into a tank that is sealed. It's 100% oxygen under pressure. And that has it's been around since the late 1800s, and it's got 12 to 14 FDA approved indications now. But stepping outside of insurance medicine, we use this to reduce pain and inflammation, to support the immune system, and then also to mobilize stem cells into circulation. So there have been a number of studies that have shown that if you do hyperbaric oxygen therapy, you recruit stem cells from your bone marrow into circulation. And as we were talking about earlier, these platelet-rich plasma procedures with the PRP, it serves as a homing signal for these stem cells. So I like patients to do the hyperbaric a few days before we actually do the procedure. And then on the day of the procedure, when I deliver the platelets to the affected area, the stem cells are primed and ready to go to that area as well.
Is there, as far as the diet is concerned, is it, if they're not eating, if you've got somebody that comes in, they're a college student or they're a college athlete, and obviously the 20-something, their diet is not very good because they think they're invincible.
Yep.
But in a very similar way to when Weston Price wrote Nutrition, Physical Degeneration, he said if a couple was going to have offspring, if they're going to have kids, they would have to have certain diets in certain older areas of the world. That for example, I think in the northern UK area, that they would travel for days to get a certain fish to have the gallbladder of this fish, because it was provided certain nutrients to the mother that she would have to eat this thing routinely leading up to the pregnancy or the conception. Is when you work with somebody for this procedure, and let's say they're a college student eating McDonald's and all the laundry list of foods and chips at night and Cokes and all that stuff. Pepsi too. We're not going to single anyone out. But if they're on that diet, they're on that late teen, early 20 diet, do you start, say, 3 months out so that their body is acclimated, so that when you do utilize these things, that they're already in a better position than they were when they were eating all the junk diet?
Yep, exactly. The longer, the better. So I've had, I'll give you an example of a woman that I saw in 2022. She's a high-powered federal attorney. She got to me from a Major League Baseball picture I was taking care of. He reached out to her after I treated him, and he's like, "Hey, listen, this is a good family friend of ours, and she wants to do PRP for her hips and her knees." And so she flew out to see me in August of 2022. And, she was overweight, but very, very physically active. She played polo all over the world. She's in her 60s, still an avid horseback rider. And we went over the PRP pre-procedure protocol, and I emailed her my anti-inflammatory diet and meal plan. She got it, and she's like, "Hey, I want to do this for 3 months before we do PRP." I'm like, "That's fantastic. Let's do that." Well, 3 months later, she lost 40 pounds. Her knee pain went away completely. We still ended up doing PRP on her knee, more for preventive reasons, but her knee pain went away, and we treated her hips as well. This was December 2022. We kept in touch for the first 6 months via telehealth, and then she messaged me in January of this year, and she's like, "Hey, PRP is still working great. I'm doing amazing, but your anti-inflammatory recipes have been life-changing." She's like, "I'm still down 40 pounds. I've got my family eating all this healthy food." But getting back to the college athletes, so I do have some college athletes I've taken care of, and their diet was In-N-Out burgers, like literally 3-4 times a week with soda. And so in those cases, I like them at least 4 weeks on the anti-inflammatory diet, really cleaning. Because these are physically fit people. So the only thing that's missing is the dietary component, right? Because like you said, they're in their early 20s, they're invincible. They can eat whatever they want, and it's not going to manifest physically as, "Oh boy."
Any time of day or night that they want.
Exactly. We were there. I'm 50 now, so 30 years ago, I could eat whatever I wanted to. It was amazing. Yeah. And
you want a pizza at 1:30 in the morning, order it up and eat half of it, and you can go right to bed.
Absolutely.
Miss that freedom.
Me too. I'm not gonna lie. But but with these younger kids, absolutely. The longer they can be on their diet and optimize their overall health and well-being, the better their outcomes tend to be. And it's pretty impressive because my collegiate athletes, when we've gone through the pre-procedure protocol, they've been on board. They're so disciplined in their sport, and like we were talking about the psychological aspect of being injured and being taken out of the game, right? So if you have an MCL sprain or an LCL sprain, these are sprains of the ligaments on the knees. I see that quite a bit, or a labral tear in my young hockey players. I see those quite a bit too. It takes them out of the game. And so there's a psychological component. They start to get depressed. They're like, "Hey, I can't do what I want to do. Is my career over? What's the next step for me?" And all this stuff starts going through their head. But we focus on that as well. So I'll get them to usually a sports psychologist or a sports psychiatrist, and then work on the mindset and all, psychological aspect of their injury, and then focus on the diet because a lot of these
Mhm.
kids aren't eating well. But yeah, and then you put all that together, and then we have a successful outcome. I think that's why my positive outcomes are so high. I
Yeah,
don't think
I
I'm any better than anyone else. It's just a matter of like I'm very selective with people that we do these procedures on
yeah,
because they are
people
paying
that are going to
cash.
listen to you,
Yeah,
they're going to listen to you that they can
yeah,
have the outcome that they want because you're part of their team. I mean, you're working with them to get an outcome that you both want. I mean,
exactly.
no one goes into and through all the difficulties of getting the education that you have and the time put in and the hours upon hours of residency and things like that without a deep passion to want to help somebody and heal somebody. So once you get to the level you are now, as you said, you're 50 years old, um, then your motivation is to cure somebody. And if someone is not going to have the same level of commitment, I don't blame you for not working with them either, because then if they don't and they leave and they say, well, I went to, this place and this doctor and he didn't help me worth a damn. Well,
Right.
that's a reflection of you. And even though
Yeah.
they're the ones who are responsible for it.
Yeah, and I'm all about lifelong relationships. I mean, that's how I set up this practice. It's really about connection, right? And at the end of the day, I want poster boards out there.
Exactly.
I want this Major League Baseball player to go out and send his family and his friends from all over the country to come see me because he had such a good outcome, right? And that's what we're looking for, right? Because that's so rewarding. I've made it my life's mission to help people return to who they are. And what I mean by that is when you're injured, you have chronic pain or acute pain, it takes you away from the things that you love, from your friends, from your family, whether you're a weekend warrior, a professional athlete, or a grandparent who just wants to play with their 3 or 4 year old grandchild. When you're dealing with pain, it can alter that course completely. And so if we can use modalities to help people alleviate that pain, they get back to who they are and who they want to be.
I had my vice is baked goods, and my mom's a great cook and baker. And growing up, of course, in the 70s and 80s, cookies and cakes and things like that. It was at every fun occasion, weddings,
Yeah,
birthdays, baptisms, birthday party, all the things that were fun were there. A lot of people, and the atmosphere and the mantra there was all everybody's happy. So
yeah.
when I went through I call it climbing the mountain for myself and my own diet, climbing, it was very difficult to break that cycle. But when you get diagnosed with shingles and then you get cancer, you're very, very motivated to do whatever you have to do to get rid of those diseases. And
Sure.
luckily for me, I did. Um, but even to this day, sweets are a struggle for me, even though I've gotten to a point where if I can have, let's say, a couple cookies or a small
Hmm.
piece of cake, if I notice that it doesn't bother me and I go have another one, within
Yeah.
10 minutes of eating the second piece, I feel like I'm going to vomit. So for
Yep.
me, I've done it long enough,
Yeah.
7 years now, to where it self checks. It's like, you really want to feel that bad again. So it's like, like you said, the trauma of being hurt and you're going to go play your sport and then it starts to hurt again. It's kind of burned in. Do you really want to go feel that bad again? Um,
Exactly.
but that's hard to get through to somebody who doesn't even realize how bad their diet is and how it's affecting them physically through their gut health and then through the inflammation of the soft tissue and the joints. It's like, you
Mhm.
tell them what's your diet and they're like, it can't be my diet. Like, well, I'll tell you what, why don't we try it for 3 months and see how much better you feel.
Right.
And for myself, I try to tell people, it's not like some do. I have had friends who have gone through the transformation and within a short amount of time, they felt phenomenally better. For
Hmm.
myself, and maybe it was because I wasn't a junk food fanatic where I'm pounding it every day. It would be like, let's have a couple pieces of cake while we're watching the Sunday's golf event or the NBA finals or something like that.
Hmm.
But for me, it was every 3 months I would look back and say, I feel better than I did 3 months ago. Like it wasn't even a doubt. Like if someone asked me, do you feel better? Yes, I do. So it was a continual 3 months, 3 months, 3 months. And after a year, I'm like, I'm completely different than I was a year ago. But some people, I guess, if they're pounding a bag of chips at night and slugging it back with 3 beers or 3 sodas or whatever they're drinking, and they're doing that 4 nights a week, and they're eating pizza or just stopping at their local fast food joint 3 days a week. I mean, if they really that far off the spectrum, and you pull them off for 3 weeks or 3 months, I would have to imagine they're coming back and saying, "This is you're amazing. Like they've got a picture of you up on their wall at home, and they pray to it every night before they go to bed. They feel so much better.
If only it were that easy. Well, let's talk about that. So I see patients who have told, like, I ask about nutrition and diet with pretty much every single one of my patients. That's a big part of what we do here. And I've got patients who drink 2 liters of soda every day, and that's the only liquid they consume. They wake up, they have Diet Coke, and then, throughout the day, they're drinking their 2 liters of Diet Coke. There's no water involved. That's not someone you can take and just say, you need to stop this cold turkey, switch to this entire different lifestyle.
Yeah, the withdrawals, they won't stick to it. The withdrawals are too
Exactly.
strong.
It doesn't work. So I tell people, like, I'm not a fan of these fad diets or these trends that you see on social media, or even with some of the thought leaders in the field of medicine and alternative medicine. I believe in making small lifestyle changes, right? So the person who's drinking 2 liters a day, cut it down to 1 3/4 a day. Do that for a week. See how you feel, and then start weaning off of the soda over the course of 3 months, if that's how long it takes, and replace it with sparkling water or something a little healthier than soda. Same thing with sweets. Like, I've got a sweet tooth also, and I'm a cookie monster. I love cookies. Chocolate chip cookies are my favorite. That and pizza, which is terrible, right? But those are my two favorite foods, hands down. I eat those very sparingly now, but it did take me some time to, like, really curb my sweet tooth, and I did it slowly over time. And now, I mean, I can go weeks without a cookie or without sugar, and I'm fine with that. And, I think with these people who have just these bad habits, and it's, just because of the society we live in, I mean, those foods are accessible and they're marketed to us. They're like, this is it. Everywhere you go, a convenience store, a gas station, right? There's bags of chips and there's soda. It's the easiest stuff to consume. But
it's everywhere that's accessible at a grocery store or a gas station or wherever you're going in. It's the most easily accessible food, and I would have to imagine that if you looked at the spreadsheets of those businesses, that they're also the highest margins.
Absolutely.
Not that I'm knocking the business model, but it goes hand in hand that the highest margin things are obviously the worst for people.
Exactly. Yeah, and that's the whole food industry. I mean, we can get in a whole conversation about the food industry and, what they've been doing to us. And, it's definitely profits over health for sure. And, but I think really making small dietary lifestyle changes is key. So, with my athletes, I feel like it's totally different because, the young 20-year-old who's eating burgers and pizzas and, drinking beer and sodas, they'll commit to the anti-inflammatory pre-procedure protocol because they're injured and they have a motivation to, right? But our everyday people who are living an unhealthy lifestyle but don't even know it until I start bringing it up to them. For those people, it takes a lot more time. It's really changing their mindset around food, around eating, and even around shopping. And understanding, like, it starts with making healthy food choices. And so the choices are the most important thing, and that empowers them, right? You put the ball back in their corner, and then they get to choose the foods that are ultimately going to be the best for them, of course, with guidance.
Do you see, is there a threshold that if somebody has an issue, whether they tore a meniscus at some point and they tried to heal it and it's not healing to the level, still giving a problem, or they have a bad disc herniation, degenerative L4, L5, as whatever level, cervical could be, the same. But since we're talking about low backs and we're on a golf podcast and everybody seems to have a back issue, is there a certain level that degeneration gets to? That you look, even if they come to see you and say, whatever you tell me to do, I'm going to do, follow to a T. Is there a certain level that they get to that even all the things that you're able to do, that they're not, you're not able to help them as much as you hope or as much as they hope?
Absolutely. I mean, I do see people with advanced disease. I mean, I see patients from all ages. From, I think my youngest right now is 16. My oldest is 98. And so with more advanced diseases, like bone-on-bone osteoarthritis, so that's bone-on-bone knee, joint pain, hip pain, even in the spine. Yeah, those people tend not to do as well, unfortunately, with these regenerative modalities, and some of the treatment options are limited. So one thing I like to do is, promote these therapies sooner rather than later. So we've learned from a number of studies from knee osteoarthritis. I mean, right now, there is no better treatment for mild to moderate knee osteoarthritis than PRP. The evidence is insurmountable. I mean, it's extraordinary. And there have been a number of studies that have shown that the proteins in the plasma, alpha-2 macroglobulin, interleukin receptor antagonist protein, some of the growth factors that are in platelets, these are actually what we call disease modifying. What that means is they prevent the breakdown of cartilage. And so I know in myself, and I've talked to some other experts in the field who treat elite athletes. So I've got a bad left knee. So I started lifting weights and wrestling when I was 13. And then I got hardcore into tennis, racquetball, mountain biking, hiking, running, and kept on lifting weights. Yeah. But no
Just
one
really
taught.
beat the hell out of yourself.
I did, but no one taught me how to work out, right? So at 13 in our wrestling team, I mean, we were just in the gym lifting weights. No one's teaching us proper body mechanics or anything. Well, somehow, fast forward to around 2017, I find out I've had pretty advanced knee osteoarthritis in my left knee. So I had to give up racquetball. I stopped running, stopped hiking. And in Arizona, giving up hiking is kind of a big deal because it's such a beautiful area for about 9 months of the year. And I discovered these platelet-rich plasma therapies, right? So I underwent PRP, and I'm a fantastic responder to PRP. So I've been able to maintain my knee health and function with PRP injections just once a year. But I also put it in my healthy knee. So my right knee has no issues whatsoever, but I still put PRP in my healthy knee to prevent the breakdown of cartilage based on the evidence that we have. And so I like to extrapolate that to other body parts, right? Even though some of the mechanics are different, but to hips, to shoulders, and the joints of the spine. There are published papers last 20, 25 years that have shown that platelet-rich plasma injected into the facet joints, which are the joints of the spine, prevent the overgrowth of the bone, which is something that happens over time, especially in active, healthy people. When you work out, you load those joints, and over time they become diseased and arthritic, right? PRP can slow that process down. So it's something we can do to be more preventive. So getting back to the original question with these advanced degenerative changes, it's really hard to manage them. It really is. And that's where we go maybe more traditional and use these ablative procedures like radiofrequency ablation to destroy nerves that will shut off pain signals temporarily. And that sometimes worked and sometimes doesn't, depending on how bad the disease is. But, hopefully your listeners will, learn a little bit more about platelet-rich plasma and its potential to be what I like to call anti-aging. I like to tell my patients, what's more anti-aging than preventing the breakdown of your cartilage in your joints? So if we can preserve joint health, cartilage health, spine health, we can increase our health span and our function well into our later decades of life.
Yeah, and I would say most people in my area, I'm in Hilton Head or just off Hilton Head, it's obviously much smaller than the Scottsdale, Phoenix area, but at least it's still, I would say the demographic heavily leans toward retirees or people very close to retirement who still want to lead an active life, golf being one, tennis, pickleball. I know you had a article and some information on pickleball as that's become the craze, but we're in areas that are heavily towards outdoor activities that don't take a lot of, they don't have to be in a gym all the time. It's not playing. They're not playing basketball. They're not playing football or even flag football. They're doing things that older demographic tends to do, and so I think that we see, you obviously more than I just see it at the golf course. You're seeing it in the clinic. That generation who could benefit from it. It's better to get ahead of it, even if you say, "Oh, I'm just 60 years old," or "I'm just 50 years old," and that's just getting older. It's like, well, you can do this stuff now, and you can still move when you're 80, and as opposed to just you're sitting around and you can't move because you hurt so much.
Right. Exactly. Yeah, I've got a handful of people in their mid 50s, avid golfers, fishermen, pickleball players, and they're seeing me with very mild to moderate pain and dysfunction and discomfort. And they're like, hey, I want to do this stuff now. So in 20 years, I'm not going to have advanced disease and I can continue living my active and healthy lifestyle with a lot less pain. And that's become my ideal demographic now, is seeing people in their mid 50s to mid 60s who haven't developed advanced disease, but who are starting to get their aches and pains on a more regular basis, sometimes even to the point where it might take them out of the game or they're not playing as well. And, treating them early, I think we're going to see some significant changes in their later years that are beneficial.
Especially what's the cartilage? Is it between the facets on the back, on the spinous processes of the vertebrae?
Mm-hmm.
When those really when the cartilage there gets worn down, and then you're bone on bone on that, it's not like
Yeah,
you can just go in and replace that. I mean,
you
you're kind of
can't.
screwed once that happens.
You are, unfortunately, you are. I mean, we can do things to reduce the pain and reduce inflammation. I think PRP is one of the best things we can do. I mean, that's been shown to be a potent anti-inflammatory, and can provide longer term relief than steroids. And yeah, but once that cartilage is gone, we can't regrow it, right?
Oh,
And
geez, I got to get out and see you soon before I lose all my cartilage.
yeah, I'd be happy to help you out. I mean, I think it's important, you know. I mean, I think that's how we got connected. One of our mutual friends,
Hmm.
Matt Galogli, yeah,
Yep.
yeah, I think he reached out and said, "Hey, this guy's doing some pretty cool things, and you should consider talking to him about it." But I mean, that's a lot of what I'm seeing out here of our people who are starting to have these degenerative changes and who are becoming more educated on the possibilities of reducing that degeneration or slowing the progression of that
Hmm.
degeneration. Yeah.
We had touched a little bit on, well, before I go into more on diet and the gut brain connection and the blood brain connection and things like that, as we talk about diet, how it affects physical, but can also affect psychological, the way anxiety levels, which our society's ridden with, things like that. I want to put that on the side a minute because I want to ask you,
Yeah.
with hormone replacement therapy is very big in today's world. And it seems like the age is coming down further, where you're looking at some people in their 30s now getting males testosterone
Hmm.
replacement. You have it, not TRT, is it BHRT? Is that,
Yeah.
do I have it?
Bioidentical hormone
Bioidentical,
replacement
yes.
therapy.
Can you talk about that? Because I found that fascinating. I'm sure a lot of people out there listening are going to say, well, what the hell is that? So can you talk about that? Because I thought that was very interesting. And then I've got some follow-up questions and the differences between that and TRT as far as side effects with RBC, hematocrit, hemoglobin increases, and even the potential for things to grow that you don't want growing. So,
Sure.
but first, if you would describe what that is,
Yeah.
and
So
the difference between that and TRT.
right, right. So bioidentical hormone replacement therapy is using bioidentical hormones, so hormones that are very similar to our own naturally produced hormones, and keeping them balanced throughout life as we age. Um, Especially in the chronic pain field, we see people who have high cortisol levels, and these stress hormones, will have massive effects throughout the body and on our entire endocrine system, and it can affect testosterone levels, estrogen levels, progesterone levels, DHA levels, DHEA levels. All these levels of hormones can be affected by stress and chronic pain. So, as part of our holistic pain management program, we offer bioidentical hormone replacement therapy to, first of all, diagnose hormone imbalances, and number two, find ways to correct them. And it's not as simple as just using testosterone. Sometimes we'll also use HCG, which has become very hard to get,
Very
unfortunately.
hard to get.
Yeah, and it's
You get the
become very
FDA involved in
expensive.
anything that works, and it becomes extremely expensive.
It's so unfortunate. It really is. I mean, because I think that was a great tool that we had in our
Hmm.
arsenal. Low dose anastrozole, which is an estrogen blocker, and that can be beneficial. So I think you have to look at all these. And clomiphene is um,
I've
another
been
way
on
we
all
can
of them.
actually. Yeah,
I've taken all
yeah,
those. They were
exactly.
great.
Same. I have too. Yep. And most of what I do in my practice, I've experimented on myself to make sure that I had a positive physiological response and a positive outcome before I implement them, especially these alternative therapies, right? I mean,
Hmm.
they're all based on science, and there is evidence to support everything we do in my practice. But getting back to the hormone replacement therapy, I think that is a key element in someone's overall health and well-being. And we can go in so many different directions with that. But you know, for chronic and acute pain. When people are suffering from chronic and acute pain, one of the things we ask them is, how is their libido and sex life? I mean, that comes up all the time, and almost invariably, patients are like, "I have no libido, and my sex life is gone because I'm in chronic pain." But it's also likely related to hormone deficits or hormone imbalances. And so it's very rewarding when we can diagnose those issues and correct them, because it gets people back in the game. It gets people back to who they are and living the way they want to live. But it also allows me to have a better outcome in terms of pain management as well.
Yeah, it was very interesting because I when I was first had the shingles and they really found out my gut was a mess. I did the HCG and I did the HCG diet, basically 1,100 calories a day, which was for 30 days. And I dropped fast. I think I lost 35 pounds. And then did it again. And I got too thin, and I called the doctor and said, there's no way. I was 2 weeks in. I said, there's no way I'm getting to 4 weeks of this. I'm dreaming of food at night, and I'm waking up middle of night hungry. I said, this is too much. So he said, well, he goes, stay on it, but go strict keto. As far as eliminating, because we're trying, I had a lot of inflammation, and he said, we'll cut the carbs or eliminate the carbs still, and we'll knock that inflammation down, and then we'll see where we need to go. But when I was diagnosed with cancer, obviously that testosterone was done. I was off it for 2 years, and then I asked, what would be the effects of being off testosterone for long-term health, and the first thing was, well, your brain and your heart, it's not going to have what it needs to regenerate at the level that it should to live a healthy life this way. And then I was driving I have to get I'm highly allergic to fire ants. Unfortunately, got a whole slew of shit going on. But I was driving to get my shot one day, and I'd only been to the immunologist office about 100 times. And driving down the road, and I was like, I know he's over there, but all of a sudden I couldn't remember how to get there. And this was after almost 2 years of being off testosterone. So I'm like, okay, call him back up, say, let's get back on it. Now, when I was really struggling, and when I got diagnosed with the disease, my testosterone was at 215, and I was 46 years old, so in the tank. They said, you shouldn't be this low at 90 years old. And I said, I don't want to feel this bad when I'm 90 years old either. So, but after I got back on it, and that would have been August of 23, I believe, maybe 22 or 23. And then that fall, I'd already gotten back to working out, but I started lifting 5 sets of 5 or 3 sets of 5, heavy again. And I was doing ice baths. And by November, when I had my yearly physical, my testosterone was 700. Now, I'm sure people have jumped higher, but to go, the highest I'd ever gotten it in just the TRT without the exercising was just under 500. When I got back into the lifting again, now it's 700. So, I'm sure people out there saying it does have disadvantages, and I'm not saying it doesn't, but you got to sit there with your doctor and say, what are my advantages? What are my disadvantages? Which ones can I take the risk on versus the other one? Because something's going to get us all, and you got to take the best chance that you can to live as long as you can the life that you want to.
Absolutely.
That's what I've learned from all this.
Yep. And it's getting back to individualizing treatment protocols, right? So it's not one size fits all. That's why you got to spend time with people. I mean, our insurance-based system doesn't let us do that. And that's why, I've had to make the decision to drop insurance and see fewer patients who find value in spending 45 minutes to an hour with me at the new consultation, just so we can connect. And it's really about finding out what each individual patient needs, right? And people will tell you what they need if you just listen, but I don't think you can do that in 5 or 10 minute insurance-based visit. I mean, at least I couldn't, I mean, I was fortunate in the first half of the first 75% of my career in private practice, the first 13 years, I was able to make some pretty deep connections with people just because I truly love what I do. And I'm all about authentic human connection. And even though my time was limited then, I was still able to make some deep, powerful connections and build the foundation for what I've started in my current solo practice, which has been for the past 3 years now. But spending that time with people, I've learned that people will tell you what they need, and they'll tell you what's really going on if you just take the time to listen. And once I find that out, I can really start tailoring a treatment plan specifically for that individual person. But there are a lot of factors. I mean, hormones have their risks, and it's important to have that detailed conversation with each individual person. And if you're someone considering hormone replacement therapy, I'm not a fan of these pop-up shops where people go in and get a testosterone shot, all these male clinics that are all over the place. I just don't think those are safe, and they're not doing it right. And the long-term consequences of that could be very detrimental. I think it's important to sit down with someone who's trained in endocrinology and hormones, and who has a good solid understanding of how these hormones work and what's safe and what's not safe, and what's safe for one person may not be safe for another person. So
Do the bioidentical hormones, do they have side effects similar or different than TRT does? Like, for example, the TRT, with myself and a number of friends who have done it, red blood cell count tends to run a little high. Hematocrit, ferritin will run
yeah,
high.
yeah.
So does the bioidentical, does that have similar side effects, or is it have its own slew of things that you got to keep an eye on that are
Um,
different?
Kind of both, but yeah, it does have the same side effects, and we monitor the same thing: serial CBCs, so complete blood
Mm-hmm.
counts, so we can monitor the hematocrit, PSA levels. Also, I mean, we keep an
Yes.
eye on PSA levels, because that's a marker of prostate health. Basically, it's a prostate specific antigen. It's a little immuno marker that we can measure that tells us if your prostate may have a possibility of some type of process going on. It may not be
Mm-hmm.
cancer, but it could be an infectious etiology too. So, but
Yeah, I
yeah.
had
Mhm.
one of my buddies who he was one of my first phone calls, and I got diagnosed because I had prostate cancer, was what my cancer was, and he had a
Okay.
testicular, and then he had, when he was younger, and then 20 years later he got prostate, and so he when I was considering going back on testosterone, um, he was one of the ones I called for that as well, and he said, "Look, I've had cancer twice, but," he said, "now, they had to remove one after he had the testicular cancer,"
Mhm.
and he said, he said, "It's not that I don't have a choice. I do, but I need to have the testosterone." But he said, he said, "You go through it twice, and it's like, I'm going to live my life, and this is what I need to do it." He said, "So I'm going to do this until I can't do it anymore." It's just like, it's either that or you're not going to have any energy to do anything. So it's like,
So, yeah,
make up
that's
your mind.
risk. That's right. Risk versus benefit, right?
Mm-hmm.
And that's different for each individual person. I mean, there are some risk and benefit ratios that are the same for everyone, but then in this kind of a case, I mean, yeah, this person has no quality of life. And so in that case, the benefits outweigh the risks. And we have those discussions, and we just monitor carefully and closely, serial blood tests and, exams. That's what we have to do.
Mm-hmm.
And that's okay. It's
And it's
okay.
crazy because I'll
Hmm.
cycle off test. I'll go 12 weeks on, 4 to 6 weeks off. And as soon as I get off it,
Hmm.
they'll run because they just wanted to check when my blood cell and ferritin and stuff were getting high. And I can't remember which of the markers it was like 455. And 3.5 weeks after being off, it was down to 155.
Oh,
Like,
wow.
yeah, we
Yeah.
figured, yeah, it's the testosterone that's ramping that stuff way up there.
Yeah. So in those kind of cases, it's important to donate blood. That's one way you can
Yes.
relieve the hemochromatosis. Yeah, the
The red,
hematocrit issue.
well, the phlebotomist, I was going there, and I didn't realize, even with they were whacking me about $300 and some at a time, and then they just throw the blood away into their biomedical trash. And I was like, wait a someone told me, well, just go to the Red Cross, it's free. Now the only downfall for anybody out there who are considering going to the Red Cross is they only let you do it every 60 days.
Right.
So if you need to do it every 30, well, then you got to find another alternative, which I believe there are some. It's usually in some rougher areas because the homeless will usually go there to donate
Okay.
blood and get paid $50-$60 for their blood, which
Sure.
is kind of ironic that you don't know what they're doing to their bodies, but they'll pay them to get their blood for certain instances.
Right.
So they're all are alternatives if you need to do it 30 days. But if you're only going to do it every 60, the Red Cross is a pretty good way to go, since they usually do it quite often. They know
Yeah.
what they're doing, and it doesn't cost you. I think if you have certain blood tape, they'll even pay you, I think, $50 or something like that for your blood.
Okay.
So
Yeah.
it only found these things through experience and trial and error and making my own mistakes.
Right.
That you look
Yeah.
for alternative ways to save $300-$400 a pop instead of going and getting blood sucked out of you for 20 minutes.
Absolutely. Right on.
Diet. I
Hmm.
really want to get into diet with you in the time we have left, because it is so important. It can control and fix so many things that otherwise people would be, as we are in a pill popping. Take this pill, in the Ozempic era. Take this pill or this shot and lose 50 pounds in the next 30 days, and take this pill and get rid of this. But if people would just modify their diet, that they could self cure, so to speak, or with working with someone like yourself, that they could alleviate and eliminate a lot of their problems, inflammation being the biggest one. So I guess that wouldn't be an easy question, but a beginning question would say, where do most people go wrong with their diet, and or what should they be doing? If someone's out there and just they're struggling because they're lost, they don't know what to do, what would be your advice as far as their first step?
Well, get help. I think it's important to consult with a primary care specialist, a
Great
naturopath,
advice.
or a specialist, someone you trust. I think that's the first thing you need to do is like, hey, look, something's not right with me and I want to get healthy. I mean, that's the first step, is just making the choice that you really want to get control of your health and you want to change something about what's going on with you internally and externally. And go seek professional help. See a primary care specialist, naturopath, like I said, specialist also, and we can help you get on the right path. And again, it's not one size fits all. It's really understanding what food choices people are making, understanding the psychology behind the food choices they're making, and then educating people on the fact that food is medicine. We're not taught that. I mean, we're raised on boxed foods, processed foods. I mean, the cereals that we grew up on don't even have any nutrition. They're fortified with vitamins because the stuff has nothing in it that's nutritious, right? So it's a whole psychology of reversing that understanding that, wait, this isn't food, this isn't healthy, this isn't good for me. Well, this is what I've been eating for decades of my life, and this is what I feed my kids, and this is what we do. That whole psychology needs to change, and that's time consuming. But when people have that aha moment, that's the first step. Then number two is really having them understand that food is medicine. Our body, I like to tell people, our body is a pharmacy. It produces everything we need inside of us. We have all the capabilities to heal ourselves. Food is the fuel for that. We eat the right foods, eat the right nutrition, get the right supplements, we can fuel all our neurotransmitters, make all the neurotransmitters we need, make all the immune cells we need, make all the red blood cells we need. Everything we need can be optimized through food. That's the first place to start. Of course, there's diet, there's exercise, there's exercise, there's mindset. I mean, all of that stuff. But food, I think, is the basic. Really working on making healthy food choices. We start there, and then we can build on that. And I think that's the first place we would start.
What in your practice, in your clinic, and people that come to you, what would be the definition of a healthy food choice versus a not healthy food choice? Because if they get online, they get on Instagram, they look at 10 or 20 different people.
Mm-hmm.
This isn't a knock on him because he's obviously very good at what he does, but you got Lane Norton,
Mm-hmm.
and he's out there saying that seed oils aren't the worst thing in the world, and they're not he's kind of bucking the alternative trend to say seed oils are not good for inflammation and these other things. So if somebody's going to look at that, and
Mm-hmm.
Lane is obviously a PhD in nutrition, he's very good at what he does. He reads a lot of the studies and stays on top of that. But I have found, at least for myself, and this goes back to what we've been talking, maybe the mantra of the show is that health is an individualistic thing, and it
Yeah.
might not bother Lane or people he's worked on or that were in those studies can bother a lot of people. And it goes back to what I said early on, is you would not be as successful as you are. Well, given your history, you'd be successful in whatever you did. But I mean, your clinic, as far as successful as getting people healthy and doing what they want to do and lead the lifestyle they want to live, would not have that success if you did not know what you were doing. So how does, what my question is, what would be in your practice if someone
Mm-hmm.
comes to you tomorrow and says, I want a healthy diet? What are you telling them to do as far as eating?
Great question. So first thing I do is I direct them to our website. We have an anti-inflammatory meal packet on there. It's very, very simple. It's a PDF people can download, and it
I'll
has
have that. I'll put
recipes.
that in a summary too. I'll put a link to that
Great.
so people go right to it.
Yeah, and those are actually my wife's recipes. So, Nikki, yeah, she's a phenomenal at-home cook. She's extraordinary. But she actually treated her own autoimmune disease through food. She saw multiple specialists, naturopaths, she saw endocrinologists, and no one could get it right. Functional medicine specialists, no one could get it right. So she did her own research and found foods that were triggering her immune response. and was able to eliminate those and create meals around the healthier food choices for her. And that was the foundation for our anti-inflammatory meal plan. So I direct people towards that. It's free. All you have to do is open up your computer and download it. And then there's grocery lists, there's recipes, and that's a great place to start. And I tell people, look, you don't have to follow, like, we have breakfast, lunch, and dinner. There's like a 7-day meal plan, a 7-day diet plan on there, or meal plan on there. Pick one thing and maybe do it once a week. And next week, maybe add 2 things. And then maybe the third week, add 3 recipes, and just slowly build on that. That's where we start. Simple, basic. Like we're talking about the person who's drinking 2 liters of soda. Don't stop cold turkey. That's going to wreak havoc on your system, and it's not sustainable. When people come to me like, hey, I want to lose weight and I want to go on keto, I'm like, that's great, but our body needs carbohydrates. And if you starve yourself of carbohydrates, once you come off the keto, you're going to gain all that weight right back, because you're going to be, so starved of carbohydrates that's all you're going to crave. So I think it's about finding a balance, right? And that balance is different for every one of us. Talking about seed oils are typically found in processed foods, right? And so my advice is to try to stay away from processed foods as much as possible. But if you're eating a protein bar that's got some seed oil in it once or twice a week, I think you're going to be okay as far as inflammation. I don't think that's going to kill you or cause this horrible disease or disrupt your gut biome to the point where you're going to be sick all the time, right? But I think it's all about moderation. I really do. I think that, the seed oil controversy has been ongoing for quite some time, and there's people on both sides, and it's been debunked, and then it's, there's a lot going on with that, but I think that at the end of the day, it's about moderation and eating whole foods. I mean, our goal is to have people eat whole foods, like real foods, not the stuff that's processed, not the stuff that's in a wrapper, but eating real food with real nutritional value. So,
what? Because I know you guys, you have the supplement section on your website, and I want to touch on that as well. Do you think that the need for supplements is due to the over farming and the nutritional deficiency of the food in our society today? And
yeah,
I would have to say that outside of some indigenous cultures around the world, that would probably be a planetary issue, where you have major countries or cities that are just, I mean, you're talking about hundreds of years where they've been doing the farming in these areas and providing for billions of people around the world. So do you think that there is a nutritional deficiency that has allowed for the supplemental market or there to be a need for a supplemental market?
absolutely. I mean, I think JAMA published studies like 20 years ago, the Journal of American Medical Association, that, the majority of people in the US are magnesium deficient, right? We do these blood tests, but the blood measures the magnesium outside of our cells, floating around in our plasma. And so those levels might be fine, but we don't know what exactly is inside our cells working, on our biological systems in a functional way. I believe that a lot of our foods, because they're factory farmed now and our soils are depleted of minerals and nutrients, that even eating a whole food diet, you're probably not getting all the nutrients you need. So I believe there is a need for supplementation. I take supplements every day, and quite a few of them, handfuls. But I go several hours without eating too. It's just my lifestyle. It may not be this would not be the lifestyle I'd recommend for anyone, but it works for me. So I do intermittent fasting. It goes back to my anesthesia days at Cleveland Clinic. I mean, during my residency, we're working 80 to 100 hours a week, and in the ORs very early, and we wouldn't get breaks for hours. Several hours sometimes. So I just got used to going 12, 16, 18 hours without eating, and I'm fine with that. That works for me. But in that one meal a day that I do have, there's no way I'm getting all the nutrition and nutrients I need and the vitamins I need. So I take supplements throughout the day. Every now and again, I'll have a protein shake, but I try to limit those as well, because getting back to processed foods, I mean, a lot of those have some seed oils and other processed chemicals that can be detrimental. But I do those a couple of times a week. It's not an everyday thing for me, but I do take supplements every day. And most of my patients, I feel, benefit from supplements. And we have several different supplement lines that we support. all CGMP certified, which means they're third party tested, made in FDA approved laboratories and pharmaceutical grade. And, I'll tailor supplement regimens towards each individual person and help them find what they need. But yeah, I absolutely believe supplements are necessary because we're not getting all the nutrients we need. I mean, our US RDA is based on the minimum amount of nutrients needed so we don't have a deficiency, right? But it's not to promote optimal health. And I think that's where the supplements come into play, is really to promote optimal health.
When someone comes to your clinic, how do you go through blood testing or some sort of testing to figure out what they're deficient in, so that they're not just going to their local GNC store and saying, well, I'll try I saw so and so on TikTok that said I need 5,000 vitamin C's, and I saw someone said I need 20,000 because it's winter of vitamin D, and I need vitamin K, and I'm going to grab these 4 different types of magnesium because I'm not sure which one I'm in, and pretty soon they're running the toilet every 10 minutes because they got too much magnesium in their system. So is there a way that you identify for an individual
Yep.
what they're deficient in and what their protocol is?
Yep, great question. Yeah, so a lot of my referrals come from concierge medicine physicians. So these are primary care specialists who have offered like an elite level of service, and many of them are functional medicine trained. So they'll come to me with all their food allergies, their food sensitivities, their nutrient deficiencies, and if they're not fully being corrected by their primary care, then I'll add some things that I think will optimize their overall health and well-being from a musculoskeletal and spine standpoint to improve pain. Some are coming from naturopaths as well, right? But the ones who aren't, we can do a hair follicle test. And we run that here in the office, and it gives us food sensitivities, potential food allergies, and nutrient deficiencies. And so based on that analysis, we can come up with a detailed plan. Ideally, we like to do everything through food, right? But for some people, it's unrealistic to eat 8 meals a day that's going to give them all the nutrients they would need, right? So that's where the supplements come into play, and we can tailor the supplement regimen towards each individual person.
Of all the things we went over, one of the questions I got when I posted on Instagram to say, ask a question if you have one. One of them I thought was very interesting. That was, how do you, and I think we've touched on a lot of them, but just to get some clarification for this person, they had asked about nerve pain. And I said, okay, are you talking about shoulder nerve pain, thoracic, cervical, lumbar? They said mostly back nerve pain. What would be the ways that someone could go about if they can't get out to Scottsdale? Let's say they're in Eastern Pennsylvania, or they're in Scranton, or they're in Waterloo, Iowa, or whatever they're from. What would be ways that they could curb nerve pain? Would you say diet would probably be one of the top things, and then maybe giving it some time off that nerve pain subside or that inflammation go down, and then get with a corrective specialist, and then hopefully by that time, if it hasn't gone away, they can come see you? Or is there other things that they should do? And what would be your advice on that, since that is getting right down into your nucleus of your expertise as far as nerve pain and pain elimination?
Yeah, that's a great question. I think you nailed it. The first step, I
Oops,
think.
I didn't mean to answer.
No, it's great. It's great. But but I think the first step would be to diagnose what the nerve pain is coming from, right? So I think it's important to see a specialist, primary care, a good chiropractor, really diagnose what the issue is, and then work with a physical therapist or a physical medicine specialist to learn what you can do to promote relief or take the pressure off that nerve, right? Whether it's a biomechanical entrapment or if it's a fascial entrapment, which means that it's happening in the muscle or the fascia surrounding the muscle. It's important to find out what you're treating and where the nerve pain is coming from. Then diet, of course, that's going to support your overall health and well-being. But I think the physical medicine part of it is huge. Usually, if you give people enough time, and if they're working with someone who's highly skilled and qualified, we can get pressure off nerves, especially if it's an acute injury like a herniated disc. Not everyone needs injections. It may take several months, but working with a qualified individual, a specialist, ideally a doctor of physical therapy, we can get pressure off those nerves. They can get pressure off those nerves to promote better body mechanics. So that's a good place to start. And that's available everywhere throughout the country. I mean, you don't need to see someone like me for that. You can just go to your primary care doc, let them know what's going on. And primary care docs are excellent at least getting the ball rolling and making an initial diagnosis and then getting the person to a good physical therapist. But that's where I would say that's the best place to start.
Yeah, so that will occupy a good 3 to 6 months to if it's caused by an inflammation, if your diet's going to help a limit or drop that down. If you give it, as Doc Stu calls it, your virtual surgery. So just taking
Yeah.
time off of whatever activities you're doing to allow
Yeah.
that area to calm down, and then getting with a therapist. Now, if you've gone through all those steps and you're, let's say, 6 months in and you're still having problems, then they need some specialty that you have. If they're going to
Absolutely.
fly halfway across the country, then they have that option at that point. But do the simple things first.
Absolutely.
And if you're a golfer, maybe you have to modify your swing. Talk to your swing coach or whoever it is, or physical therapist, and say, "Hey, let's get to the deep root cause of this, so that I don't go back and then 6 months from now I'm back in here and we're starting from step one all over again." That is
Exactly.
talk about mentally devastating. You go through 6 months of getting it right, and then a few months later you're back to doing what you did to cause the problem, and then you're right back where you started. That is really draining mentally.
Absolutely. I'll give you an example. Like these 19-year-old golf pros I take care of who've been golfing since they were 3. Like, they'll identify the issue, but they've got 16 years of conditioning
Mm-hmm.
that they have to undo. 6 months isn't going to do that. They can learn for 6 months what they did wrong and correct it. But then when they're back on the course in a tournament, they're going to revert back to their 16 years of conditioning, right?
Yep.
So it just takes time, and unfortunately that does happen, and they're back in my office re-injured. They're like, hey, I did everything right, but you re-injured yourself, so you didn't do everything right, unfortunately.
You're
you
missing a
know
piece of the puzzle.
exactly, and that's hard. It really is hard, but it comes down to undoing the things that have caused you to end up in this situation to begin with.
Have you gotten into much of the sauna or the ice bath, cold plunge type therapy?
I'm a big
Work with
fan of
that?
it, but I cannot do the cold plunge yet. I want to. I started with cold showers in the mornings, and I'm like, this is terrible. I don't enjoy this. Like, I'd rather
It's
do a
not.
hot shower. Yeah, I'm not getting that dopamine and serotonin release that I'm supposed to get that's going to make me happy all day. The cold
Well,
shower is not working for me.
you've got Morosco's right. He's got Dr. Seeger, Tom
Yeah.
Seeger, who's the
Yeah.
CEO of Morosco. He's been on twice, and he's in
Oh,
your area. I
cool.
mean, he's in Scottsdale somewhere. He's in
Yeah.
Tempe, I guess, so
Hmm.
not very far from you. I'll connect you guys. He's
You're
great.
great. Awesome.
Love that guy. But in doing it myself, I've been doing it on and off for about 5 years, and I've been doing it consistently for about the last year.
Awesome.
Um, for various reasons. I mean, the litany, again, individualistic who you talk to. It couldn't, some people, it really jacked up their testosterone without anything
Yeah.
else. Some people, the effect of type 1 diabetes has been almost eliminated. But to your dopamine epinephrine effect, I started out with the cold showers. I'm like,
Hmm.
this is bullshit because it sucks. And
It
I
really
don't really
does.
feel much better afterward, not for a
Yeah.
few minutes after, but it's when you do that commitment to you're going to feel like shit.
Hmm.
And it's worse pre getting in the first 60 seconds. Then once you're cold and you stop shivering, you're fine. You're
Yeah.
like, okay, I'm just cold for the next couple of minutes. But once you start to get it, at least this was for me, because I started at about 55 degrees after I did the cold showers, because that was all I can handle.
Yeah.
And then I got to 50 pretty quick, because in a week or so, I'm like, okay, 55 after the first 60 seconds this is not doing anything. I got it. I think the coolest I got down to, a bunch of friends of mine who are big, and it said, that's no, you're still amateur. I think I got down to 41, which was pretty damn cold.
That's pretty cold.
But
Yeah.
for someone like yourself, as soon as you get that sub 50, and so that 45 to 50 range is kind of your first. You're getting out of the hills of just getting over stuff, and now you're getting into the low levels of the mountains. You're not getting to the sub 30 yet, but that area is where, at least for myself, and I tell everybody who's thinking of doing it, that's where you're going to start to feel, probably within 15 to 30 minutes after you get out. For the next few hours, you're going to feel that energy kick.
Right on.
And I did it. I had the motivation to do it when I was off the testosterone. I needed to find something to give me that energized feel, that motivation that I wasn't getting from TRT anymore.
Sure.
And that was what pushed me to grind through to get into the mid 40s and even below. But that I get you. You go from, my experience was, you go from just it sucks, So once you start getting in those lower temperatures, for me at least, and my girlfriend, I got her doing it now for the last 4 or 5 months, it's the skin irritation.
Yeah.
So the cold, it's so cold on your skin. It's not so much you're shivering because you adapt to that, or at least we have very quickly. But that it's so cold on your skin and that deep ache, like if you keep an ice pack on for too long. Now imagine that all over your body.
Right.
That for us right now is the challenge. But like anything, you just maybe you back off for a little bit and then you push it a little more and you back and you keep going back and forth, and eventually the body, as you said, adjusts in a good way, and you're reaching new levels that you thought 6 months prior I'll never get there, and here you are. And next thing you know, you're 30 degrees and you're holding up ice like Joe Rogan.
It's amazing, isn't it? I mean, that's the power of the mind. I mean, we can do this, right? We can do this. I'm just not there yet.
No,
I will be though. I will be. Yeah, because I know the benefits of cold plunging and infrared sauna and going back and forth between the two. I think Huberman has described some protocols that are pretty interesting and are backed by science. And one day I will be cold plunging. But
I tell you what, I have done the on Sundays. I now my back got irritated for about 4 months, so I had to pause the gym membership. But one of the guys there, he's in his 70s. Doc, what is his name? He was from Spain. He was on the judo team from Spain for like 6 Olympics. This guy's amazing. I'll send you his info too. He's got a great PDF book. He just came out with. He retired a few years ago. He's still built like a bull. He's 77 years old. Can't believe this guy's as big as he is. But we'll do on Sundays. We usually connect and we'll do sauna for 20 minutes, cold shower for 5, and we'll cycle that about 3 times, about 15 minutes. So it's about an hour total.
Wow, yeah.
That one that gets to be a challenge. The third round you do, but the one that for me just wiped me out. That it was like I'd never experienced anything like that before. Was I did. Years ago, when my back was really flared up, this was when I didn't know what I was doing. In a 46-degree cold plunge, or ice tank, I was getting into that, and I did a 2-minute hot shower, and I did that 3 times. The third round I did that, I had to make myself go back in. But I could almost feel like someone put liquid plumber into my arteries and veins, and you could feel all of a sudden that blood was pumping, and it just flushed all that coagulated blood out.
Amazing.
I wasn't 100%, but I was at least 50% better.
Yeah.
So long, cold, short, hot was much more difficult than long, hot, short, cold.
Okay.
I don't know if anybody else experienced that, but keep that in mind if you start playing around with it.
I will for sure. Yeah.
Is there anything we missed? We covered a lot.
No, we did. No, this was great, Pete. Thank you for having me on the show, and it was great talking to you, and allowing me to share my passion with all your viewers and listeners.
Tell everybody, we'll have it in a summary, but go ahead and tell them if in case they're driving or working out, where they can follow you, social media, Facebook, Twitter, all the good ones, and website and all that stuff.
Our biggest platform is Instagram. So it's Dr. Ashu Goyle. That's DRASHU Goyle, Goyle. So if you just look that up on Instagram, it'll pop up. That's the same for our website. It's dr.ashu Goyle. That's for YouTube. Sorry, our website is www.ispwscottsdale.com. So it's Integrated Spine, Pain, and Wellness. That's the name of my practice. So it's ispwscottsdale.com. And those are our 3 big platforms: YouTube, Instagram, and our website.
Perfect. And the paper that you were part of with Dr. Capro, is that on your website?
It should be. Yeah, it should be listed under my CV section.
Okay. I will pull that up. I'll have a link to that in the summary so everybody can check that out. And if you have in pain and you have not had success, please reach out to Dr. Goyle, especially if you're going to be in the Scottsdale area. Doctor, it's been a pleasure. We'll have to do this again. And I plan on getting out to Scottsdale. I got a lot of family and friends out there. And when I do, I'll give you a heads up that you can look at my train wreck of a body and tell me, this we can maybe fix. This one, you waited too long. You're too old and beat up.
Yeah, no way. I think you'd be surprised what we can do. Yeah.
Cool. If you'd hang out for just a minute, and everybody, thanks for tuning in. We'll catch you next time.
Great. Thanks.